Climate change is one of the biggest global challenges of our time. It's already affecting people around the world and will continue to do so in the future. But how does climate change affect health? And what are some of the ways that we can protect ourselves and our communities from its impacts? In this video, we lines explore these questions and learn about the latest research on the relationship between climate change and health. So let's get started. Before we dive into the effects of climate change on health, it's important to understand the different ways in which climate change can impact us. We can experience the impacts of climate change directly or indirectly. Direct impacts are those that result from extreme weather events or other changes in the environment caused by climate change. For example, when a hurricane makes landfall, the strong winds and heavy rainfall can damage buildings and infrastructure, disrupt essential services, and cause injuries and fatalities. This is a direct impact of the storm itself. Similarly, rising sea levels can lead to coastal erosion and flooding, which can also harm people directly. On the other hand, indirect impacts are those that result from changes in the environment or the way that we live our lives because of climate change. For example, when a drought reduces the availability of water resources, this can lead to water rationing or even water scarcity, which can then indirectly affect people's health by limiting their access to safe drinking water. These are just a few examples of how climate change can impact us in different ways. It is important to understand these different pathways so that we can develop effective strategies to protect ourselves and our communities from the negative impacts of climate change. So let's take a closer look at the effects of climate change on health. First, let's consider the direct impacts. One of the most obvious ways that climate change affects health is through extreme weather events. As the climate system changes, we're likely to see more frequent and intense extreme weather events such as heat waves, floods, droughts, and wildfires. Each of these events can have devastating impacts on human health. For example, heat waves can lead to heat stroke, dehydration, and other heat-related illnesses, while floods can cause injuries from drowning or exposure to contaminated water. Droughts and wildfires can also have serious implications for air quality, leading to respiratory problems and other health issues. In addition to these acute health effects, extreme weather events can also have chronic impacts on our health. For example, living in a community that has experienced a major disaster such as a hurricane or a flood can lead to long-term mental health issues such as post-traumatic stress disorder, anxiety, and depression. People who live in areas that are affected by extreme weather events may also experience chronic stress and anxiety due to the constant threat of future disasters. This chronic stress can lead to a range of physical health problems such as high blood pressure, heart disease, and stroke. Another way that climate change affects health is through extreme heat. As average global temperatures rise, we're likely to see more frequent and intense heat waves. Heat waves can be especially dangerous for vulnerable populations such as the elderly, children, and pregnant women. During a heat wave, it's important to stay cool and hydrated, but not everyone has access to air conditioning or other cooling options, especially in low-income communities and in developing countries. Extreme heat can also exacerbate existing health conditions such as heart and lung diseases, making them more severe and more difficult to manage. Next, let's talk about air pollution. Climate change is likely to make air pollution worse, which can have serious impacts on our health. As temperatures rise, pollutants in the air can become more concentrated, leading to higher levels of air pollution. This can lead to respiratory problems, cardiac issues, and other health problems. In fact, studies have shown that exposure to air pollution can increase the risk of developing asthma, chronic obstructive pulmonary disease, COPD, lung cancer, and heart disease. Additionally, children and the elderly are particularly vulnerable to the effects of air pollution. Studies have shown that exposure to air pollution during childhood can lead to long-term respiratory problems and cardiovascular disease later in life. In older adults, air pollution can exacerbate existing respiratory and cardiac conditions, leading to hospitalizations and even death. Now, let's move on to the indirect impacts of climate change on health. Food insecurity. When it comes to food security, climate change is already having an impact on the availability and affordability of nutritious foods. Droughts, floods, and other extreme weather events can reduce crop yields, leading to food shortages and price increases. This can make it difficult for families to access the healthy foods they need to maintain good nutrition, leading to malnutrition and other health problems. In fact, studies have shown that climate-related disasters such as droughts and floods can lead to significant increases in malnutrition rates, especially among children. Water quality, access to safe drinking water is essential for good health. But climate change is making it harder for many communities to access the water they need. Changing weather patterns, such as altered rainfall and increased evaporation, can lead to water scarcity in many regions. Additionally, rising sea levels can contaminate fresh water sources with salt water, making them undrinkable. This can lead to a range of health problems, including dehydration, kidney disease, and even death. Infectious diseases. As the climate changes, the geographic range of some infectious diseases is likely to expand. This means that diseases that were previously found only in tropical or subtropical regions may begin to spread to new areas. For example, the Aedes aegypti mosquito, which is responsible for spreading diseases such as malaria, dengue fever, and West Nile virus, is already expanding its range northward as temperatures rise. This means that diseases that were once limited to a few countries may soon be found across entire continents. Additionally, warmer temperatures can also lead to the emergence of new infectious diseases. For example, the Ebola virus disease emerged in the Democratic Republic of the Congo in 1976, and the Zika virus was first identified in a monkey in Uganda in 1947. Both of these viruses likely emerged due to changes in climate and land use that brought humans into closer contact with wildlife and disease-carrying animals. Mental health. Experiencing a climate-related disaster such as a flood, a hurricane, or a drought can be a traumatic event that leads to mental health problems. In the aftermath of a disaster, people may be struggling to cope with the loss of their homes, their belongings, and even their loved ones. They may also be dealing with the physical injuries and illnesses that resulted from the disaster itself. In addition to the emotional toll of these experiences, people may also feel a sense of powerlessness and grief over the destruction of their communities and their way of life. All of these factors can contribute to mental health problems such as anxiety, depression, post-traumatic stress disorder, and even suicide. Vulnerable populations. Not all populations are equally vulnerable to the impacts of climate change. Some groups, such as the elderly, children, and those with existing health conditions, are particularly vulnerable to the effects of extreme weather events and other climate-related disasters. For example, young children and older adults are more likely to be hospitalized or die during heat waves. Similarly, people with disabilities may face greater challenges in evacuating an area during a wildfire or other disaster. Climate change can also disproportionately affect certain communities, such as low-income communities and communities of color, which often face greater exposure to environmental hazards and have less access to resources and services to help them prepare for and recover from climate-related disasters. This means that climate change can exacerbate existing health and social inequities both within countries and between countries. Finally, it's important to consider the impacts of climate change on health systems themselves. Extreme weather events can put a huge strain on healthcare services. Disruptions to electricity, transportation, and communication systems can make it difficult for people to access the medical care they need. Healthcare facilities may also be damaged or destroyed, which can lead to the loss of essential medical equipment and supplies. This can make it even more challenging to provide quality medical care during and after a disaster. As we've seen, climate change is already having a profound impact on our health and well-being, but it doesn't have to be this way. By taking action to address climate change, we can create a healthier and more sustainable future for all of us. One way to do this is by supporting policies and initiatives that promote clean energy and reduce greenhouse gas emissions. We can also make changes in our own lives to reduce our carbon footprint, such as making more sustainable food choices, reducing our energy consumption at home, and supporting businesses that prioritize sustainability. We can also advocate for policies that protect the environment and promote public health, such as policies that limit air pollution or protect natural habitats. Finally, we can educate ourselves and others about the impacts of climate change and what we can do to make a difference. By working together, we can create a healthier and more sustainable future for all of us. Thank you for watching. If you enjoyed this video, please don't hesitate to share your thoughts and comments below. We would love to hear from you. And if you haven't already done so, please consider subscribing to our channel to stay up to date on our latest videos. Thanks again for watching, and we'll see you next time.